Hello, and you're very welcome to the Health Research Podcast, where today we are exploring how to break into the policy life cycle to bring about change. This podcast is a production of the Health Research Board, which is Ireland's state agency for conducting and funding health and social care research. I'm your host, Dr Claire O'Connell, and in this series we explore how research and evidence can help to shape better policies to benefit everyone. So that's service users, communities, society at large. In episode 1 of the Health Research Podcast, we talked about the importance of communication when it comes to influencing health policy and behaviour. And we focused largely, though not exclusively, on the researcher perspective. And in this, our second episode, we're going to focus more on the policymaker point of view, with that theme of understanding how to break into the policy life cycle to effect change. And I'm delighted to be joined by two people who are experts in this very subject. In studio, we have Dr Anna Visser. Anna is Principal Officer at the Child Poverty and Wellbeing Programme Office in the Department of Taoiseach here in Dublin. And beaming in online from Brussels, we have Dr Thomas Hemmelgarn. Since 2021, Thomas has been head of the EU Policy Lab, which is a creative space that fosters cross-disciplinary exploration and innovation in policy making. So you're both very welcome to the Health Research Podcast. Now, the policy life cycle, this can feel like a bit of a mystery to those of us who are not involved in it. And I'd love to learn from each of you a little bit more about what policy life cycles are like. I think we need to understand that context before talking about how researchers can perhaps target the best way to break in there. And I'm a biologist by training, so I suppose when I was doing my studies, we used to read about life cycles as lovely diagrams in textbooks where you'd have distinct developmental phases and characterized by certain factors, and then a nice arrow would bring you to the next phase. I'm just wondering, is real life like that in policy development? Does such a textbook image exist for that life cycle? Could life be that simple? Anna?
Well, we have lovely textbooks and lovely images too, and there are many of them that describe the policy life cycle, and different people will use different ones to help understand. Very recently in the Department of the Taoiseach, we've published a policy handbook which has its own life cycle. It's called the 5 Ds, and it goes from what is the demand for policy to deepening understanding of the issues, designing with the best advice possible policy outcomes, then making decisions and moving to delivery. But as you indicated in your question, I've never come across a policy process that has run smoothly from phase to phase in that way. In reality, you're jumping across things. Sometimes you go straight into the decision-making phase without having done the preliminary phases. Other times you could get stuck at what is the demand piece for a really long time. You might move on to another phase and then find yourself dragged back into something again. So the reality is that these processes are really iterative, and there's a lot of backwards and forwards and a lot of interdependencies, and they happen in a context, and that context will influence how the policy life cycle unfolds. But like your biology diagrams, they're a really useful way for people to help understand the various different possible phases of the process and how they might stitch together.
Thomas, would you agree at a European level? Is it the same, the 5 Ds?
Yes. It's very much the same system. We don't have 5 Ds. We have literally a cycle, which is a conceptualization of the different phases. So for us, it's very much structured and formalized in what we call our better regulation agenda, and that sort of is a system which we apply when we prepare a policy. But the stages are very much similar to what Anna alluded to. So we have a planning preparation stage, which is really to understand what is the policy need. So that's basically the first D for you. And but that also goes then with the planning in terms of the Commission work program. So this is sort of an annual work program where we inform the public also about coming legislative proposals. Then, of course, we have the actual development of the proposal. And that's a lot of work with stakeholders, also researchers and scientists, to get to an understanding of what is actually the problem definition. That's a lot of time we spent on that to get that right. But then also to quantify the effects. And we do this always across 3 dimensions, the environment, the economy, and the society. And that's true for all policies, including health policies. So we would also run this, of course, for health policies. We then move to the implementation. So get this to the ground. I mean, what would this mean? Of course, that's very different for us here because we often work with directives, for example, which then have to be transposed into national law. So we rely obviously very much on the member states and their implementation and, of course, administration on the ground to do this. And then the last bit, and then the cycle closes magically, is the evaluation, of course. So we look then after 3 years, usually there is a first review, both in terms of is it working in the first place? Can we do it simpler? Is the burden, which was created possibly in administrative terms, high? And then basically you close the circle. But the circle is very conceptual, and I fully agree with Anna. Of course, politics works sometimes a bit different because this is iterative. So sometimes the policy urgency makes it that some of these processes basically run at the same time or even at different points in time. But I think for us, it's important to have this conceptualization, to structure the work, and also it's helpful for scientists, I believe, to have an understanding of where are the leverage points where science can come in.
So we have the concept or the theory and we have the practice. Why is it important that researchers take the time to understand both?
Because I think it helps you understand the ways in which research can interact with the policy cycle, because it will take different forms at different times. So, for example, research can be very formative in terms of the demand for policy. It could well be that researchers themselves are articulating a problem or finding something out or considering what possible solutions might be. So sometimes you see it that actually it's the research itself that's creating the demand, even before public or politicians or whoever else is involved has got to that point. At other stages, it could be much later in the process. So when you're at the decision-making phase or design, and there's, specific directions you could go in. We could do this, or we could do the slightly other version of it, or these are the different options. At that stage, you'll find that the policy-making process is looking for research which is specifically targeted at those unique questions. And that will require a slightly different interaction with it, because there it's about knowing who might be working on them. If I know who the researcher to contact is, I can pick up the phone and say, listen, we really need to figure out this thing. What do we have on that? And so it'll be very different. Sometimes it really will be that blue sky, very open-ended, agenda-setting type of engagement. At other stages, it'll be much more specific. And that very much interacts with the conversation you had on the first podcast about communication, because there will be different communication styles at different points in the policy cycle. So the policy cycle might not be immediately obvious in real life. It'll always be there in some shape or form. It might not be immediately obvious to the outsider that there is this process going through. But if you understand the elements of it, and if you understand how research interacts a bit differently at the different stages, that can be really helpful in thinking about how you can bring your research to that process.
And Thomas, what about understanding the policy development at European level? So why should researchers in EU member states pay attention to that, what's going on at European level?
I think it's very important to say that we have, of course, a lot of research here at the European level with the Joint Research Centre. So we are located in the Joint Research Centre, where we have about 2,700 people and almost 2,000 scientists who work across all domains of EU policies. So we are quite unique in this, because the Commission has its own Directorate General, which is basically the knowledge and science advisory, if you want, and producing science specifically for our policies. At the same time, we have calls for evidence, notably in these processes when we go into development of proposals where the researchers come in. So there is sort of a structured process of bringing research in. But I fully agree with Anna. I think for the researchers, it's important to understand the structure of the policy cycle, but also the nature of the reality of it. Because research has different dimensions. And maybe to name two examples, on the discovery, it's absolutely true that research sometimes creates actually a policy need. To give you one example from our foresight work here, we had a recent study on neurotechnology, so the interaction of technology with brain data, or data created from the brain, which goes into technical devices. Now, this has a number of both medical and non-medical implications. It's very early stage, But currently there is no real regulation or thinking about regulation on this, even though with the advent of AI, this might actually develop quite fast. So this is a typical example of where we try then to have in the discovery phase to be anticipatory also in looking at what might be future governing issues and regulatory issues. The other is implementation. I mean, when you think of a lot of EU legislation, of course, and a lot of the work we do also here is about implementation. And maybe just one example where we help, we have a European beating cancer plan. As you might know, this was adopted 5 years ago at the beginning of the last mandate here. And we have been working on a knowledge center on cancer, which basically has a European cancer information system. So we really collect then data from different sources to inform the overall state of cancer research, but also cancer treatment across the EU. And I think researchers can always be contributing to this on the different stages, in the discovery phase, in the implementation phase, in the evaluation phase, but they have to understand, is my research connected to which phase and to which issue the policymaker is facing? And I think that's why it's so important that the researchers have an understanding of how the policymakers structure their thinking and what the issues are they face.
So Anna, Thomas just gave us there the examples of where researchers have been bringing evidence to bear on policies relating to, that interface between brain technologies and the brain, and also beating cancer. From an Irish perspective, are there examples where research has had a clear impact on policy direction or development?
I think there are many, many examples, and they cut across the policy life cycle. And that's really evolved and changed over the last 10, 15, 20 years. I think we're operating in a dramatically different policy-making context now to we might have been in previous decades. So I've worked very much in the social policy area. I was head of research and evaluation in the Department of Children prior to my current role. And one of the things there was we commissioned the Growing Up in Ireland study, which is a major longitudinal study of children's lives in Ireland. And I think what's really interesting to that is it speaks to the point that Thomas was making about policymakers access research in very different ways. Sometimes they'll be generating that research themselves. So the Joint Research Centre obviously has an enormous resource in terms of its own researchers that are doing very specific evidence-driven, policy-driven evidence development. Sometimes we'll commission work, and sometimes we'll look at what's already out there, and it'll be less specified. But with something growing up in Ireland, that was a really significant and continues to be a really significant state investment in the research landscape. And why government decided to fund that study was because 20 years ago we knew very little about children's lives in Ireland. We knew a lot about kids' lives in the States or perhaps in the UK. We drew on that an awful lot, but it isn't the same thing as knowing how things are developing in Ireland, how the context is changing, what's happening in children's lives. So there's really major ways that study has influenced specific policy development around education policy, choices that are being made. But one lovely one that I came across during our time working on the Ukraine crisis and the response to the Ukraine crisis in those really early days when suddenly we had loads of people arriving from the Ukraine overnight, and there was this mad scramble to try and find accommodation. And really in the department it was all hands on deck. Everybody found themselves out in Dublin Airport helping. But one of the questions that arose is, well, what about pets? People were bringing their pets. They were landing their cats and their dogs into bags or into their cars and arriving with their pets, which creates a challenge for accommodation, as you can imagine, right? Because not all accommodation and hotels and B&Bs will take pets. But we had included in Growing Up in Ireland over several years a question about pets and what do pets mean for children? How important are they? What impact do they have on child development outcomes? And it was funny because several times we'd face the question about, should we really ask that question? Is that really a policy relevant question? Maybe we should leave it, because there's always a battle about how many questions you can ask. And suddenly we had this data about actually, you know what, pets are incredibly important. They're incredibly important for child well-being and child outcomes, and we really need to find a way, if at all possible, to facilitate this. And the pets question was there because as part of the development of the survey, kids told us pets were important. I'm not sure lots of us believed them, but that's what they said. So it went into the survey and it turned into this incredibly useful resource. So that's what I mean by you don't always know what are the things that are going to prove important. And that's a tiny example, but just it's that balance between, we have a lot of discussion now about evidence-driven research and the need for research to be responsive to policy, but we also need to hold the space for the more blue sky pieces, the more open-ended pieces, because you don't always know what's coming at you around the corner.
Yeah. Absolutely. That's a great example, actually, and one that I'm sure had a huge impact on a lot of people ultimately. And so I'm interested to hear how we're talking about sort of evidence-based policy or evidence-informed policy, but also policy-informed evidence. So I think sometimes researchers see, evidence for policy, but actually it's a two-way street, that sometimes the policy dictates what the evidence needs to be. And as you say then, Anna, as well, the more blue sky stuff that you think, well, we may never need to know the answer, but there may be a case in Dublin Airport where we do. Okay. Can I ask you about that? Again, one of the things we talked about in the last episode was that need for policymakers and researchers to be in communication. What are the typical channels at the moment for that kind of communication? Thomas, in Europe, do researchers and policymakers generally spend a lot of time together, or is it something that everybody needs to work on?
Yeah, I mean, we have a specific situation for the researchers we have here, of course, in the Joint Research Centre, because we do work basically hand in hand with the policy directorate generals who are holding a specific policy. Take our Director General for Health and Food Safety, which would be a main player when it comes to health at the European level. And of course, the colleagues who work with them hand in hand. The same goes for other areas like agriculture, environment, climate, technologies like AI. So there is a specific axis, and it's interesting that the first time in this mandate, the Joint Research Centre is actually mentioned in the so-called mission letters the President gives to the commissioners at the beginning of the mandate. So in each mission letter, we are mentioned as the evidence service, which helps with assessing the impact of policies. So there we are, I think, due to the specific role of the Joint Research Centre, we are in a very specific situation because we work with them. But that doesn't mean that we need or we stop working on the communication, because there is still, I think, a gap because the research has different timelines. So sometimes the policy need, and you alluded to the fact that sometimes maybe the policy drives the evidence. Policy needs for evidence might be much faster and sort of more pressing than what researchers can produce, given sort of the timelines in research when it comes to peer reviews and doing proper data work, for example. So there is still, I believe, a lot to be done. In general, when it comes to general science, what we try to do is we have usually, before we actually start working on the proposal, we have calls for evidence. So these are on our website, which is called Have Your Say, which is our public consultation website in all EU languages. And that's where researchers actually do come in. But also we see, of course, that might not be known always, and we might not always get everybody in. So we also use our expertise here, and we work with academia across the globe, basically, to make sure that we have the right experts also contributing to specific areas. Maybe one last point, and I guess we come to this, but I really liked what Anna said about this sort of the serendipity sometimes of having a little bit of research which you don't really know, is this now immediately relevant? But I also believe this is important because, I mean, the past has shown when we have had big crises, that sometimes a redundancy, if you want to call it that, in the system where you have some work where you say, well, how is this immediately policy relevant? But suddenly a pandemic hits and models which are used to model the distribution, or rather the growth of the pandemic and the distribution of the virus in the population, which have been maybe a bit sidelined, suddenly are in the limelight. So having a little bit of blue sky research and also to testing out some areas which might not be immediately policy relevant is very important. because we cannot predict the future. Even though I do foresight here, I don't have a crystal ball, but we can prepare our organizations to be agile enough to react to these type of things. And what Anna mentioned, I think, is a good example of having this space to do that as well.
Great. So there are lots of channels there in Europe for policymakers and researchers to work together. It's a case of everybody needing to be aware of those channels. In Ireland, do we have many of those channels, Anna, in your experience?
We absolutely do. And as I kind of hinted at earlier on, I mean, that has changed a lot in the last few years. So I think new researchers or earlier mid-career researchers are coming into a totally different context, perhaps, in this area. And also there are much higher expectations on them that they will engage with policy development and public debates. So I think it's interesting to think of the two sides of the coin. One, obviously, is within academia. There are things happening anyway to disseminate research, whether that's conferences or articles. And I think you can have a reasonable expectation that policymakers will be keeping an eye on that. There are now research units in most government departments, if not all government departments. And we would be looking at journal articles. We would be looking at what conferences are emerging. We'll be keeping an eye on what emerging research is happening. So, all of that feeds in. I think sometimes we overlook that kind of day to day, but it's obviously a critical part of the work. And then there's formal and informal processes and structures on the government side as well, which are really intended to create those pathways for communication. And sometimes they are quite formal. I mean, obviously, we had the establishment of the Irish Government Economic and Evaluation Service. That's very much around access to research. I mentioned these units across different government departments, and Ferris and others are establishing kind of formal engagement mechanisms with academics. So it's important to know about those formal opportunities as well. And then also sometimes that's commissioning, right? There will be pieces commissioned, and we'll go out looking for things that are specific to different research areas. But I think in your last conversation on the podcast, there was that emphasis on the relationships and the informal piece too, and that's really, really important. And it might be something that's quite specific to a small country like Ireland, where chances are you know someone somewhere, you've been working in an area for a little while, or if you rock up to a conference or a policy event, it'll be very possible to speak to the person who might be working on this. And that's incredibly important from a policy perspective, because very often, where things are moving quickly or where they're a little bit uncertain in terms of what the exact parameters are, it's being able to have those conversations and those relationships that are really helpful in terms of feeding in. And that can be quite casual in an Irish context sometimes, because you might bump into someone at the coffee shop or walking down the street or on the dart on your way in. I've had conversations nearly everywhere that I can think of where you're like, how's it going and what are you working on at the moment? And that's really interesting. So I wouldn't be shy about putting your bit of research out there when you do face those opportunities, because invariably things will prove useful somewhere down the road that you didn't know were going to be useful.
Yes,
and I think
absolutely.
That's on both sides of the coin.
Yeah, very good. And I mean, those, when you're thinking about those informal networks, as you say, people you meet on the DART, the commuter train into Dublin, or at the coffee dock or whatever, I suppose without sounding too calculated about it, how do you become a trusted party that policymakers, such as people in the research units, or in Ireland's case, maybe in the Department of Health or HSE or NGOs, will say, oh, right, that's the person to talk to about that if I ever need to. They kind of tuck it away in their mental file of facts. Any tips on becoming one of those trusted sort of sources?
The most important thing that you do is your research, right? It's the quality of the research that you're doing. That's the starting point for everything. Of course, that doesn't mean it's necessarily going to connect in. You do need to take that to the next step. But that's your calling card, is the work that you're doing. And very often people are doing quite detailed, sophisticated, really interesting things because they're very driven to do it. So there's something about recognizing you bring that with you, right? You bring your values with you, you bring your enthusiasm for the subject with you, and that all builds on the quality of the research. So then it's about being specific and targeted about who finding the right person. Sometimes, policymakers might not have the time to connect you on to the next person. Very often they will. So even if you reach out to someone who's not quite the right person, they'll be keen to connect you with the right person. So take advantage of that opportunity. Attend the events that are happening. More than ever, there's lots of public engagement events and conferences and open policy debates on all kinds of subjects. But the most important thing is to ask. You know, sometimes it's ringing the switchboard and saying, who is working on this issue and can I have their name? Who Does What in Government is an enormous resource on the website. It will give a really detailed breakdown about who's working on which policy area. The reality is policymakers move around a bit so that they will change. So that's something you need to stay current with. But in my experience on both sides, having been a researcher and then moving into government, very often if you've research that's relevant and interesting to contribute, people will want to talk to you because it's in their interest to know what's going on.
Thomas, do you agree that sort of the quality of your research is your calling card? It's a matter of finding who to go and present yourself to.
No, I think that's the basic entry level condition. There needs to be excellence in the research with sort of the normal scientific process, peer reviews and so on, and publications in A journals and so on. I just want to zoom out on this one specifically, and I think it's important for government as well, because there is quite a bit of data that citizen trust in government and in democratic institutions is actually higher in countries where this evidence making is well integrated into the policymaking process. So I think one cannot underestimate also in sort of when you zoom out of a specific policy, the importance of getting the evidence right for policymaking for the larger objective of sort of keeping democratic institutions healthy and trusted by citizens. And related to that, I think for the researchers, the characteristics is you have to have the excellence in research, but you have to also be able, and I think it goes a bit with Anna's point about interconnections and more systemic thinking, you also have to be able to step away from it. So you do the great research, but then you have to have the empathy with the policymaker as well to say, okay, there are different constraints which will not allow the policymakers to do exactly what I have found in my research that should be done. And I think if you have that, plus what you discussed in the first series of this podcast, the ability to communicate and to convey messages, then you have sort of the triangle of impact, really, because that I think is needed to have as a researcher in your field the ability to also say, okay, this is the body of research and all what I know, but that of course has to then fit also in the reality of the constraints policymakers and also the people we want to address with policies face. And it's interesting maybe to say that in the JRC we started using portfolios to organize our work. And I think it goes a bit in this direction because we have 25 portfolios in our work program, and they range from artificial intelligence, Earth observation, specific health, One Health type of portfolios, up to more sort of cross-cutting elements like foresight and behavioral insights, what we do here as well. And I think it mirrors a little bit what Anna was saying about the interconnectivity. This is something we really see a lot. Systemic thinking and to have different people in the room when you think about a policy is really important. I give you just one short example from our technology foresight again. So we did a technology foresight with our health colleagues here in the JRC on airborne pathogens and their transmission in buildings. They had detected some new technologies for this, and obviously for the next pandemic preparation. So they thought maybe we should look at what technologies are on the horizon and what we need to do. So they came to us and we said, okay, this is very interesting. Let's organize a workshop. But then we suggested to them, let's not just invite sort of the tech folks who invent these filters and potential technologies. We also invited, and they were a bit surprised with that, but we told them we invite nurses, we invite patient associations, and we bring in architects. And the result was that you, of course, look at the technology, but you also understand that the technology has to be sort of implemented in a context of people working there, being treated there, and people who actually build hospitals and medical buildings. So, and that was very interesting, because the learning was that even though technologies are quite sophisticated, there are much more hands-on and low-tech solutions to some of the problems by bringing in this. And this is just one example of where we need to widen the discussion where we do policy, to have great research, but also to have people in the room, stakeholders who are on the ground. And if you mix this, I think that's really where the magic happens.
So I like how you say, Thomas, that we need to have empathy with the policymakers and the context in which they operate as well. Which kind of brings me to, do researchers maybe need to think about the types and formats of evidence that are needed at different stages of policy development? I suppose the gold standard is always the peer-reviewed paper in a high-impact journal, etc. That's not always what policymakers need, is it, Anna?
No. I mean, it's great to have that, obviously, because what you get from that is the reassurance around quality. So that really does set the standard. But the reality is sometimes policy making is very fast, or sometimes it's very broad questions, and there's an awful lot of relevant research. And so you're trying to wade your way through to find the kind of key bits. So where that's presented very accessibly, that's incredibly useful. And as I said earlier on, to the right person is also very useful. I mean, there's no silver bullet here. I wouldn't say, it's get your research onto one page. It isn't always about that. Sometimes that's useful. Sometimes presenting it at an event is useful. Sometimes having a conversation when you draw on it is useful. And it really will depend at the various different stages of the policy cycle. One thing we think about, and it's reflected in the handbook I mentioned earlier, is how does good policy making happen? Data and evidence and research is a really important leg of that stool, if you will, but also the policy decision making has to be feasible. It has to be things that are implementable, and it also has to be legitimate. So there are these three really important legs to the stool that politicians face when they're making decisions. And as Thomas said earlier, sometimes there can be a lot of different things going on in and around that space. But I wouldn't say that you put the kind of research box just over here on one leg of the stool. How do you know something's legitimate? You'll know it's legitimate because there's public engagement going on, or public surveys, or there's responses. How do you know something's going to be feasible? Well, you'll know because people have modelled and explored and thought about the feasibility. So, thinking about what is evidence as well, and what is research at the various different stages. And one thing I would say is you don't always have to wait for that peer-reviewed perfect publication, because that can take a very long time. As you have emerging findings, and as you think your data stands up and it's important, that would be the stage that I would be saying, right, okay, who can I engage with around this? Because that'll also then help you formulate, well, how do I produce it? How do I communicate it? What's going to be useful? What is happening in the policy cycle at the moment on these topics? So that's a long way of answering your question, Claire. There aren't magic bullets. It's always going to be context dependent. It's always going to depend on what's going on. But to think about all of those things and to carve out a little bit of time to think about them and engage.
Mm-hmm. Thomas, is there anything coming up at European level that Irish researchers should be aware of? Maybe initiatives they can plug into?
There's one thing we do here, or one big project which is launched by my colleagues soon, is supporting evidence-informed policy making with a specific focus on the twin transition. So the twin transition is the move towards a green economy, a sustainable economy, and the digital transition. And what we have been doing in the first cohort with the first 7 member states in a program which is funded by the European Union is to work with administrations in member states to understand what is actually the science for policy interface, and how is evidence transmitted in the national system to policymakers. So basically exactly the discussion we're having here today. Now, in the second cohort, Ireland is indeed part of the countries which take part in this endeavor. And the main contact point at this moment is the Department of Further and Higher Education, Research, Innovation and Science. I let you pronounce the abbreviation.
DeFerris, we usually say.
DeFerris.
Yeah.
DeFerris. So this, and there are a couple of other organizations in there. And really the idea is to look very country specific. And I think Anna has given already a lot of insights on how well this is organized in Ireland. But really to look country specific, then what is it? What is there? What is the stock of evidence-informed policy making? And where is, even when there is a very good system, there is always, of course, room for leveraging, but also to compare to other member states, how is it done, to work with this. But also, I think the long-term objective of this work is also to connect better national science for policy systems with the EU policy system. With the EU science for policy system, that's often us, the JRC, because we work a lot with member states also on implementation. And there is one more thing I wanted to mention in terms of training, because we do have a competence framework developed here for policymakers and researchers on exactly the questions of how should and could policymakers better engage with researchers and vice versa. So it's two-directional. And there is, even when you go to the website of the JRC Competence Framework for Researchers and Policy Makers, a smart for policy self-reflection tool. So you can actually test yourself.
Oh, okay.
And see, how am I doing? So,
very good. Very good.
And then you can, I mean, if a team, for example, you could run this with your team and then say, how are we faring? If we do an honest self-evaluation, how are we faring? And basically it runs across 7 categories, which goes from advising the political level, innovate, work with evidence, be futures literate, engage with citizens and stakeholders, collaborate and communicate. So the topic of the first podcast. So that are 2 elements, I think, which are very practical and operational also for national administrations, but also researchers to think about how equipped are we actually today and how much do we know about the other side, if you want, and are there ways to connect better? And then, of course, but I also agree that what Anna said, of course, it is then also a lot of personal contact is important. But I think reflecting on, am I positioned? Do I have all the skills? And am I equally strong in some of the elements I need to impact policy is important. But also for the policymakers, am I actually ready to take up scientific evidence, or am I blocking it because it's too cumbersome or too challenging to take it up because it goes against my beliefs or specific issues I hold dear?
I think that's so important, Thomas, that Thomas, I'm calling you, and the Irish version of Thomas now, that we think about that capacity journey as 2 sides of the coin, because very often we're talking to emerging researchers about their capacity, but actually there's a responsibility on policymakers as well to have the capacity to engage with research. And so we do an awful lot of work in that area across different government departments, and DFERIS indeed takes a lead on it. Even in the Department of Children, when I was there, we developed some guidance notes for policymakers. What does a good meta-analysis look like? What should you be looking for when someone gives you statistical analysis? You know, it's not that they have to be able to produce that analysis. That's the job of the researchers, but they absolutely have to have the skills to be able to read it and engage with it. But one thing I would say, and I'm 100% behind the focus on capacity on both sides of the coin. I think it's incredibly important. But I suppose I'd also say to researchers, if you've got good research and you're coming up with interesting findings, don't worry too much about the capacity end of it. The most important thing is that you make an effort at engaging in the best way. And if you're getting that wrong, someone will tell you fairly quickly that you're getting that wrong. But don't wait for perfect. If you think that what you've been working on is really important and has a direct policy implication, not all research has an immediate policy implication, and that's okay too. But if you feel that your work does, plow on and find the right person to talk to, because timing can be everything. So don't do every policy making course that you can find. Don't read every resource on evidence and policy. Certainly read some and have a look and speak to colleagues who've done this kind of stuff before and ask for their advice. But if you've got something that you believe is really important, it's really essential that the policy making system knows about that.
So we've had brilliant insights and advice from both of you. Thank you so much, Dr Anna Visser and Dr Thomas Hemmelgarn, for joining us on the Health Research Podcast. And that is it for this episode of the Health Research Podcast. You can listen to all the episodes on major podcast platforms and on video on the Health Research Board YouTube channel. And links to audio and video versions are also available on the website hrb.ie. But for now, from me, Dr Claire O'Connell, until next time, slán, and thank you so much for joining us on the Health Research Podcast.